Hello everyone. As you know, many students are experiencing grave concern regarding the NEET counseling. Many of them don't understand the process and many of them think that it's very tedious. StudyPlace is bringing yet another session with Dr. Jayalal, the National President of the Indian Medical Association. Welcome again, sir. Sir, as I said, that the process is quite tedious and many people don't understand it. Can you please guide the students related to the counseling and can also look into the other topics like the related topics to the counseling?
Yeah, thank you very much for this opportunity to share with you the problems and the opportunities every student who is joining, preparing to join the postgraduate medical education. First of all, I must congratulate you because out of 1,60,000 students who has written the examination, you have got a reasonably good score and you are now trying to join the medical education. Post graduation is becoming one of the mandatory option for you. So choosing the best option, probably the best college, is also one of the most important things. Now the counseling process will start in the two level. One is with the All India level of counseling, which is for the 50% of the seats, and another 50% of the seats will be taken place in the respective states. A student can appear for both, mostly from when he is from the particular state. But however, some of the states, like the states like Uttar Pradesh, state like where Delhi, where and Karnataka, Rajasthan. So these are the states where open seats are also there. That means you, even if you are from other states, if you are not a nativity of that particular state, then you will be able to appear for that examination. So you have a different option of only from the All India counseling and from the state counseling. State counseling also some of the states has open seats so that you will be also joining for that. In the All India counseling, you can choose from the government colleges and also you can also apply for the deemed university. There's a two streams in the All India counseling. In the deemed university, there is a fee structure is there that you have to pay the monthly annually fees, and also the advantage, there is no reservation system in the deemed university, so you go by the merit of your mark. Only thing you have to pay the fees, but it depends upon the your mark, even the first counseling, second. And the advantage for this year is even the fourth round of the straight counseling is going to be happen like to happen with the All India Institute counseling. So if you have a good mark, not which you can come into the government quota, but you can come into the deemed university of your choice. You can choose accordingly, and provided if you have an option of paying the tuition fees. Again, you can check for the tuition fees from the each institutions, and that you must be. It is very well available in the net. And if you are a postgraduate in surgery, if you want to join, there are deemed universities, then there are some private universities where they charge somewhere around 18 lakhs from the lowest level and 47, 48 lakhs at the highest level. So this is a rank. This depending upon your mark criteria, your if you belongs to the 10,000, 15,000, 20,000 rank, definitely you will be able to get a good college like Manipal, All India Institute, I mean Ramachandra Medical College, where the fee structure is relatively around 20 lakh. But if you are having a 45,000 or a 50,000 or even a 60,000, still you have an opportunity to get into the deemed university. But though the fee structure will be little higher at the 45 lakhs to 60 lakhs. And coming to the All India quota of the government, and where which colleges you are going to choose depends upon the certain factors. And normally, the good advice we always now try to give for the students is, if you are not a person who always want to go into the adventurous trip across the country, but it is preferable to choose the region in which that you belong to the respective colleges which are in that region. If you are from the south, and try to choose the south, and if you are in the north, you can choose some of the colleges, best colleges in the north. But that gives you the easy accommodation and accomplishment of interacting with the patients, because the language is one of the greatest concern, because wherever you are going to study, you are going to only meet the local population where you must know the language. And if you are not knowing good in Hindi, and if you are coming to the north, you will have find difficulty, but it is only a minimal. And if you are have an attitude for learning it, definitely you can. Second one is a tuition fees, and some of the institutions has a good, even if it is a government institution, the tuition fees also varies. And most importantly, you can also check into the stipend which they are paying. There are some of the states they pay very low stipend, something 20,000 to 30,000. Some of the colleges like Maulana Azad and other colleges were paying up to 1 lakh. So though that we were trying our level best to fight for the uniform stipend, it is not yet available. So that's also one of the criteria that you will be looking into that, and if the stipend is there. And most importantly, what you have to look into is the bond period, how much a bond they are going to give. There are some states, take for example Gujarat, example for Delhi, and example in some of these states like West Bengal. So there is no bonding system is there. Even if you are a student from other institute, other states coming here in All India quota, you need not do a bond. But most of the other states, especially southern states, where you have a 2 years bond is available. So again, that is some of the people are now more searching for the Gujarat, where there is no bond for the people to go for the post-graduation. So that many people are choosing that college. So you can also look into that. Second criteria, if you are a very academic oriented person, that you have to look into the college and where you have to see whether it is an age of the medical college and number of the seats in the medical colleges. There are colleges where having a 250 seats. Definitely to reach to the 250 seat, the colleges needs to have a very well infrastructure, and they must have an adequate number of patients. In normal, the NMC, the criteria is for one student, 8 OP is mandatory. Actually, one student, 4 IP is mandatory. So if there is a 250 students are there, that definitely you have something 2,500 to 3,000 OP will be there. And for the students, IP will be always something around 1,000 IP will be there. So if the college is having the more number of seats, it is always good for you to see that the college is having a good infrastructure and good OPD average. The OPD is running well. But equally, it is also has a disadvantage that when you have a batch of students, when they're coming for the 250, the personal attention on the students will be comparatively less. So if you have 100 batch students, and definitely the faculty and the student interaction will be much more higher than that what we have for the 252 students. Second option, always we look into that whether that institute have the postgraduate departments, or it is in postgraduate means super specialty department, or we have a only that broad specialty is there. Suppose you are going to take for the general surgery, and if they have all the super specialty department within that college, you have a good urology, you have a plastic surgery, neurosurgery, that definitely adds value to your study. The focus and the intensity of the study which you are going to get from those departments will be always helpful for you, and that will be always guiding you to take a proper postgraduate super specialty course also. So if there is a college which has a good department of the super specialty department, so that is also a concern. Definitely you will look into that. And equally, the age of the medical college. If it is quite a new medical college, if it is started with the history of only 5 years or this 10 years, and if you have a college which has a 50 years, and again, I will personally choose a college which is an old college, because always it has a traditional system of learning. A set pattern will be there, and it will be going in a good way. But only one disadvantage where you will get is the infrastructure facility and the building facility, your seating capacity, the furniture is there. In a old college, definitely it will look old, but in a new college, you will have a state of the art building may be there. But the pattern of education, pattern of the course which is they are running, and the way in which they are teaching you is definitely it is going to be of a great good help. And you need to also look into the website, and now every medical college is having a good pattern of their website is there. Also in the NMC website, you can go and find out the college, the average flow of the patients, and average IP is there, and how they are training, and what is their average stand of the people are there functioning also. And again, in the field, that's definitely you have certain very important people as a name, or faculties are there, and definitely if it's a particular college you can choose depending upon the faculty or the availability you are having there. Another criteria you will always look into that is accommodation and the area of the reachability of the area. If that medical college is near a city, or where the airport is nearby, where your reachability is good, or if there is a hostel facilities adequate, again that is a good. There are certain colleges where probably they are deemed universities or new colleges. They charge a good amount for the hostel, and you may not be able to get a good hostel in there. But some of the colleges you have a good hostel, the food will be good, the atmosphere will be good. So that either you can interacting with somebody's name, somebody in the college, you can get into know and asking them, and definitely they will be able to get into that. And another criteria what we are looking into that, some of the colleges has an internal super specialty quota is there. Suppose you are joining, you have an opportunity to joining in Aligarh Muslim University, and if you have an opportunity to join the Banaras Hindu University, or some of the universities in the Gujarat, some of the universities in the armed force, there they always has an internal quota for the students who are studying in their college. And that is more in the UG. When the UG, the student is from the Aligarh Muslim University, those students has some more weightage for them to get into the PG. And equally, when you are a student of them in the broad specialty PG and you want to go for a super specialty, and if you are able to choose a college where there is a internal quota is there for that, a student who are studying from that particular college will be able to get the more opportunity to get into that postgraduate course. And you can check that what are the colleges where there is the internal quota is available, depending upon that you will be there. And finally, also the college location, and with that you are going to now choose. So there is a two criteria. One is your specialty you have to choose, and your college you have to choose. And most of the people, I mean, I think what I learned from the medical students is only 20 to 25% of people are having a specific objective of joining a particular specialty. And most of the other of you are going to put the priority in a episode way. And to be cautious, because this is going to be one of the most important deciding factor for your future career. And depending upon your potential, your aptitude, and the way in which that you will be able to carry forward and choose your specialty. Just because I mean you wanted to choose somebody, some put them in an order. If you are applying for that, then you will be land up in a problem. So always remember, in an all India when the counseling, the first counseling, when you are taking up a course, you have an option to upgrade your course or join another course in the first counseling. But in the second counseling, and if you are taking a course and you have to join, when you are joining, there is no chance that you will be able to come out of that. So choosing the subject, just putting them in instead of random, that you have to always put it in a proper way, that if there's opportunities available for you to get into that course, that you will be able to join that course and continue with that course. So this is once you are getting now most of the states are simultaneously going to start the counseling in the state, and the counseling in the all India quota are going to take place. What we learned, because there's normally till the last year, only the first counseling and second counseling will be done by the all India quota. Then rest of the vacant seat will be transferred to the state quota. The rest of the seats will be by the state quota. But now in their 4 rounds of the counseling is going to be done by the all India quota. So even if you are having a low rank, and please do not forget that you have to apply for the all India quota, because even the stray round is going to depend upon the way in which that you are applying for that course, so that you should not do that. Coming to the state selection, now there is a lot of hiccups are there, a lot of challenges are there in the state. For example, from Tamil Nadu, now the system in Tamil Nadu is 50% quota goes to the service candidate, and another mark system for those who are from the tribal area, those who are working in the hilly primary health center, they are almost getting a 30% mark additional to that. So now a person, yesterday they published the rank. The student who got 564 marks, since he was working in a primary health center, he got the 30% reservation additional mark. So his mark has become 731, and he is the #1 candidate in the Tamil Nadu ranking list. So the service candidates will be able to get 50% reservation quota, their quota. Apart from that, because of this virtue of the 30% mark or the 20% mark increase, they will be in the top level, the first 20 seats. 20 ranks in Tamil Nadu state quota has gone to the service candidates. So the 80 to 85% of the seats are going to be occupied by the Tamil Nadu service candidates. So open merit candidates, the opportunity for them to get into the college is again only 15 to 20%. So when you are going to apply, choosing the career, choosing the subject, choosing the college, you have to see that your option is only very limited 15%, and you have to confine to that. And even if you are from the Gujarat now, apart from the reservation of the 64.5%, nearly this is the first time that we are getting so much of reservation for SC, ST, OBC reservation, and the economically weaker section reservation, physically dependent reservation. So it comes around 65%, and the additional 10% reservation in that is been added to the Gujarat state. So Gujarat now 75% of the seats will go for a reservation even in the All India quota. So you will have only option for a 25% of the seats to be there. So that's again even the 10% reservation can change almost 450 seats will be not nearly 4,500 seats will be changed for the if you have the 10% reservation is added onto that. So you have to be more cautious and careful about that. But friends, and this time is one of the golden time for anyone who is preparing for the NEET PG, because never ever this will happen like this, and you have an option of the March 6th. Your third counseling is going to be over, and March 12th you are going to write for the second NEET PG. So it is only a very short time. But if there is no need for to take this counseling session as a do or die session, because you have another opportunity for you within the 3 months or the 1 month time that you are going to write for an exam, and you are able to get into that. So do not compromise on your special interest on particular field, special interest on particular college, special interest on a particular specialty, saying that and this is my do or die situation. Otherwise, normally you need to wait for 1 year. Now you need not wait, and you can always take up the challenging second examination, which is coming to come for the NEET 22 very positively. So I think this is one of the luxury the students will be feeling today for the writing the exam. And now you are also very sure that the next year for the March 22, the same pattern of reservation is going to be there. That means only 65% is going to be seat on the reservation, only 35% will be there on the open merit quota. So you need to do slog out and do extra work. Now you know the rules, now you know the game. So how it is going to be played, so that you need to equip yourself to that level and face that examination confidently. And equally now, the last 3-4 years, we never seen the service quota candidates coming into that admission for a larger level. Now most of the states are now trying to incorporate the service candidate students. So again, in the states also, the open candidates, the opportunity is going to be less. So you need to work hard. So that, but again, I will say, but that is an opportunity is available in front of you to face the second examination. So that it is definitely a boon for you. So it is always remember there were 1,60,000 students are appearing normally, and you are one among the who was able to get good scoring, and 45,000 seats are available in the country, and PG seats are equally good, and then almost all the PG seats today as a good score. It is not the PG the field which is going to make you a great person, but how you are taking it up, how best you are, it is going to make you. I always used to stay, I know one of the very famous hotel in which the head cook of the hotel is getting highest salary, which even a normal, well-practicing doctor cannot imagine. He has only taken cooking as a profession, but he was able to excel in that. So it is not that, remember, unless you are having a very specifically oriented, obsessed with a particular field, always have 1 or 2, 3 fields, whether on suicide, either you are going for a surgical side or a medical side, like that, at least the broad specialty you decide and take choices, you put in some choices, that choices will definitely get, and whatever the choice you are to get, and try to work hard and definitely you will go on. Finally, I will also say in choosing that there is a one more objective which always the students now choose is end speciality versus the continuing specialty. Now you all know, even when you are doing a MS general surgery or MD general medicine, definitely that is not going to be the end of your career unless you are going for a super specialty of one of the component DM that you will not be able to get. So your career is going to extend for another 3 more years for studying the course. But however, if you are going to take ENT, if you are going to take orthopedics, you are going to take pediatrics, you are going to take PG, OG. So all these are called as a end specialty, pulmonary medicine. These are called end specialty where you can go for a fellowship. There is no more DM much courses are there. So again, some of the people will choose, and depending upon how long that you will be able to be with the academic session without working somewhere, or if you can choose some of the field where you can come, you will be able to take MSc. That's all. I mean, there is nothing more. You are going to have a PG degree. You can go for a fellowship. That's different. But so that kind is also one of the area where you will be able to decide. But nowadays, I must also thank people like Akshit and others who are making it easier for you and allowing you to ask some questions and explaining them. So remember, these are the good asset for us. And when we are coming for choosing that, we will not be able to know everything. But it is somebody is there who are studying a lot on that, who are interpreting a lot. So those can understand your feelings and problems. So always make use of people like him so that they will be definitely guide you properly to take an appropriate decision. And remember, the decision you are going to take today is going to make your career in the future. So I wish all the best for all of you, and I'm sure that all of you will be able to get a good position. And I'm so happy to welcome you into this family of our medical profession and wish you all the best. And I'm sure that I must thank Akshit and the team for this wonderful opportunity they have provided.
Thank you, sir. Thank you for such an informative session. And it was a great session, and people will be really happy to know and get some guidance by you. Thank you, sir.
Thank you.
Thank you, sir.